Jamaica company ships first legal exports of THC to United States for DEA testing. Pure Jamaican elevates Jamaica as global provider of legal cannabis with pharmaceutical THC product exports to the U.S. and Brazil. It's by Tony Lang, and this is the article. Montego Bay, Jamaica, February 22nd. Pure Jamaican, and this is a press release. Pure Jamaican and its GMP-certified licensed pharma manufacturer 710 Pharmaceuticals are elevating Jamaica's role in the global cannabis supply chain by legally exporting proprietary pharmaceutical products with cannabis-derived THC as well as hemp-derived CBD and other cannabinoids to the United States, Brazil, and other international markets. The permissions to export pure Jamaican pharmaceutical products containing THC to the U.S. were granted by Jamaica's Ministry of Health and Wellness to 710 Pharmaceuticals pursuant to valid corresponding import permits received from the U.S. Drug Enforcement, aka DEA, and the products were shipped to a DEA licensed facility in the U.S. for successful analytical testing. Once the DEA approves the rescheduling of THC from Schedule 1 to Schedule 3 under the U.S. Controlled Substance Act, as it is widely anticipated, funny how this article is leading with that, 710, isn't that a great company name, by the way? It's 7, the word, dash 10, by the way. 710 intends to request DEA permits to ship pure Jamaican pharmaceutical THC products from Jamaica to patients in the U.S., subject to valid doctor prescriptions and all relevant DEA, FDA, and state pharmacy distribution regulations. We see where this might be going, don't we, folks?
Oh, yeah.
Meanwhile, 710 has already begun shipping Pure Jamaican's Botanicos pharmaceutical tinctures with THC and other cannabinoids directly to patients in Brazil pursuant to Anvisa import permits. Together, Brazil and the U.S. represent populations of more than 500 million people, providing tremendous potential demand. Shocker, demand for cannabis. Scott Cathart, CEO of Pure Jamaican and 710 Pharmaceuticals, said, "This is a proud moment for Jamaica and for our group of companies. Jamaica has long been associated with ganja, but never before in this context as a producer and legal exporter of THC as pharmaceutical-grade medicine. As the only company in Jamaica licensed for pharmaceutical manufacturing of cannabinoids, we are proud to be leading the way to elevating the role of Jamaica in the global cannabis ecosystem." The president of Jamaica Promotions Corp, JAMPRO, Shulit Cox, said the growth of cannabis industry for medicinal purposes has been a priority of the government of Jamaica, and particularly the export of value-added products from Jamaica. The success of Pure Jamaican and 710 Pharmaceuticals is applauded as JAMPRO continues to facilitate the local medicinal cannabis industry and ensuring its role in driving growth of exports. Dr. Ellen Grizzle, Chief Regulatory and Compliance Officer of Pure Jamaican and 710 Pharmaceuticals and former Dean of the College of Health and Science, UTEC, said, "This is a labor of love and not easy. Jamaica has 52% of the world's medicinal plants in our small island nation, and we are very proud to be exploring ways to identify new botanical medicines to bring health, wellness, new exports, and economic growth to our country." So that's the story, once again, from Cannabis Business Times on Jamaica getting ready to ship legal exports of THC to the U.S. and Brazil. And I'm Elise McRoberts, a.k.a. The Hashanista, reporting live from Marin County, California, High at 9 News. So I have thoughts on this, but I would love to see what y'all have to say, and then I'll maybe chime in. But I think we see the few little points in this article that might make us Californians or Americans even wonder, why are we getting ready to accept cannabis from other countries?
I can't wait to hear what the two doctors have to say, but I feel like this is just the first step, because they said it in the article. This is the first step from once it goes to Schedule 3. You're not going to be able to buy any of this weed that you're buying now. You're going to be getting all this stuff imported from these GMP facilities out of the country, Colombia, Jamaica, all this stuff, and it's going to be, hey, boof, worse than Canadian weed.
Well, I mean, there's so much to unpack in this story. Exactly. Access point is the biggest. You're getting federal approval by the DEA to import something, but that is, FDA approved. Is this going to be delivered through the pharmacies as a pharmaceutical grade?
That's how it's
drug?
Well, no. It sounds like they're going to do direct to pay. Like basically, you're going to go to their website, upload your prescription for marijuana, because once it's Schedule 3, doctors will be able to write prescriptions for marijuana, right? And then so you upload your prescription, and then they'll just be mailing it to your house. That's how it sounds to me.
Well, when I write a prescription, I write it to a pharmacy. It's a certain format, and only licensed pharmacies
triplicate,
can
right?
sell it. So these licensed pharmacies that are already selling, it could be triplicate or regular, but they're already selling, Marinol, and they're already selling Epidiolex. So, and they're already selling, not Sativex, but they are approved formulation by formulation, so that it still needs FDA approval. That's the one part I'm confused about.
Oh, man.
Well, that article says this won't happen until, one, it passes the DEA test and the FDA and state pharmacy distribution regulations. So I wonder if it would be that way, where a doctor writes the script to the state pharmacy then fills the script with this medicine that's been approved by the DEA and FDA that came from Jamaica.
Mm-hmm.
Yeah, that's possible. It's happening now. It's happening with Epidiolex, right? Or, those things were produced outside of the country. I mean, they're now being produced in the country, but
I think everyone's going to get screwed on this one. Everyone's going to get
when
screwed.
when you can grow your own medicine, you don't need to go to a doctor. You don't need to go to the pharmaceuticalization of cannabis is going to fail miserably. We don't need mids from MSOs. We don't, right? And I guess the thing that keeps this, and this goes back to the conversation that Dr. T and I had maybe about a month or so ago, is so-called accepted medical use, right, Dr. T? So we all know that cannabis helps with numerous ailments, but that's not an accepted use because it hasn't gone through the FDA gauntlet, right? Mm-hmm. So what has gone through the FDA gauntlet? It's amazing that Elise was saying that this story is like targeting for some kind of DEA approval, DEA test. What's DEA? DEA is a drug enforcement agency. Why do they need to test anything, right? What are they testing for? They're testing for cannabinoids. Guess what? They're going to be in there. So why insert the DEA in here at all? I get the FDA. And again, Jason, exactly what you're saying. Mm-hmm. If the play is to reschedule the 3, this is how they can basically try to co-opt the market.
Exactly.
But, all of us folks understand that the legacy and the trap will win all day long there. There's no way that Schedule 3 mids from Big Pharma can compete with the trap. No way. No way, it's going to fail.
It hurts the patients the most, though, because when you think about the patients who might be looking for access to medical cannabis, THC, or CBD for the first time because it's now approved and they can get it through their pharmacy, they're going to go try this medicine, have no idea what real whole plant medicine can do for them, right? Try these isolated FDA and DEA approved compounds that in past we've seen are not as effective, right, with, Epidiolex or Marinol. So, how harmful is that to the, bazillion people who really need access to this medicine that are finally going to get it under Schedule 3? But yeah, like you say, it's going to be boof, and they don't have a plug or know that they can call a traditional shop or something to get some whole plant tincture or other form of medicine. It's not even about fire flower or bomb hash. This is about whole plant medicine that people need access to that does save and change lives.
Mm-hmm.
So I'm going to do Jamaica a favor here, and I'm going to tell them, right? When it comes to producing commodity cannabis, it's a race to the bottom, a race to the bottom. And you know that Jamaica is challenged on resources. A lot of resources aren't produced in Jamaica. They have to come into Jamaica. Jamaica is never going to win in the race to the bottom. What will Jamaica win in? Cannabis tourism. Cannabis tourism. I mean, Jamaica like no other place in the world. It's where Bob Marley and Peter Tosh started reggae music. It can totally be the cannabis tourist destination in the world, kind of like the way Amsterdam was. So you know what? Get off this high horse thinking that somehow you're going to be the low-cost producer of pharmaceutical cannabis in the world. You're not. You're going to lose at that. But you will win at cannabis tourism because people want to come down to Jamaica, listen to Bob Marley music, and smoke a big fatty as they're sucking on their beautiful drink, watching the sunset. Come on, man. That's where Jamaica's going to win. Not a low-cost cannabis production. That's bullshit.
Yeah. Tell them, Dr. Mark.
Yeah, Dr.
Yeah, and on that, we're going to go to a commercial.
This kind of passion I like to step into the room to.
Oh, man, we're going to go to a commercial.
Hey,
We're going to be right
Rico.
back.